Hello all, I am Dr. Sivaraman, Senior Shoulder Elbow Consultant from Chennai. Today I am going to talk about the frozen shoulder. Frozen shoulder is a condition in which the patient presents with a pain and stiffness in the shoulder. It is otherwise known as periarthritis shoulder or adhesive capsulitis. It can present without any cause, or it can present with the people who are diabetic or a hypothyroid, or there is other reasons are can present with the frozen shoulder, like the patients who had surgeries in the past, or the patient who had any injury in the past can have a frozen shoulder as well. Frozen shoulder is usually a self-limiting condition. It can take up to 2 years for it to have a full recovery. With a frozen shoulder, usually the doctor will examine you for the movements. The movements are usually restricted, mainly the elevation of the arm and then the external rotation of the arm. Not all the shoulder pains are frozen shoulders. The frozen shoulder is a condition in which mainly the external rotation, what they mean is this movement which arm is going outside, will be restricted to 50% of the opposite side. Then we call it as a frozen shoulder. We will examine it and then make sure that it's a frozen shoulder. You might need to do an X-ray to rule out any arthritis or any tumor in the shoulder, and sometimes we need to do an MRI scan. The treatment part of the shoulder, a frozen shoulder, is mainly it's a physiotherapy. It's in the form of a wax bath, which will improve the movements. With the mobilization of shoulder, it will improve the movement of the shoulder. And the other options are, we can give a steroid injection inside the shoulder, in the form of a steroid with a local anesthetic, and we do is a hydrodilation, is a procedure in which the shoulder will be expanded with the water and the steroid and local anesthetic. That will expand the capsule, and that will give a better results compared to the steroid injection alone. And finally, if they're very resistant cases, we will do the capsular release, the arthroscopic capsular release for the patient. But in all the treatment part, that we need to make sure that diabetic need to be controlled if the patient is diabetic. Thank you.